Good afternoon. My name is Paul Romesser. I'm the director of the Colorectal Anal Cancer Service in the Department of Radiation Oncology at Memorial Sloan Kettering Cancer Center in New York City. I'm here to kick off this exciting session, and I want to talk about critical aspects of survivorship just to set the stage. These are my disclosures. As we heard about this morning, the treatment for anal cancer differs based on your stage. Chemoradiation, which is radiation therapy given in combination with chemotherapy, is the standard of care for patients with stage 1, 2, and 3 disease. While the likelihood of tumor eradication is high, a small subset of patients may recur in the anal canal or within the pelvic lymph nodes. In patients with localized recurrence, surgery is really the standard. In patients with stage 4 disease or metastatic disease, where the tumor has traveled beyond the pelvis to other parts of the body, like the liver or lung, treatment recommendations often include chemotherapy in the first-line setting and immunotherapy in the second-line setting. As we heard about this morning, there are often clinical trials available, and I would encourage you to discuss these with your doctor because these are normally testing the newest and greatest therapies available for patients like you. Follow-up for patients with stage 1, 2, and 3 disease includes a physical exam every 3 to 6 months for 5 years after treatment completion. The physical exam includes a digital rectal examination where your physician will use his or her finger or digit to examine the anal canal. In addition, your physician will examine your lymph nodes and feel your groin to see if there's any lymph node involvement or enlargement. Anoscopy or endoscopy should also be performed every 6 to 12 months for the first 3 years. This is where a small device will be inserted into the anal canal to allow the doctor to visually inspect the anus for any abnormalities. If you have stage 2 or stage 3 disease, annual imaging for the first 3 years is considered standard. In patients with stage 4 or metastatic disease, you'll likely be on active therapy, and therefore you should be closely monitored by your physician. Interval physical examinations and imaging are really important aspects of follow-up to assess treatment response. I also recommend that you discuss tumor genomic profiling with your doctor. Genomic profiling allows us to evaluate the blueprint of the cancer. Here, your tumor will be sent to have its DNA sequenced. In a small subset of patients, tumor genomic profiling may identify an abnormality or mutation in the DNA that can be targeted therapeutically. In fact, many new clinical trials are now focused on specific tumor mutations and open to patients with a variety of cancer types. So tumor genomic profiling may potentially help your doctor identify any new and exciting clinical trials that you may be eligible for. Survivorship begins on day 1 of treatment. Elements of survivorship lead to a better quality of life during and after treatment and include surveillance, care planning, management of late and long-term sequelae of disease or treatment, and counseling on healthy life and wellness. I discuss survivorship the first day I meet all of my patients because it's such a critical aspect of care, not only after you finish treatment, but during. Reset, the roadmap to recovery, is the theme of today's panel. And reset can begin before you even start treatment. It's based on evidence, guidelines, and feedback from the community. The Anal Cancer Foundation created the mnemonic reset to help patients like you know which specialists they can turn to for relief after treatment. I outlined some of the follow-up care that can be expected from your oncology care team. The experts coming in now are additional specialists who can help with pain, bowel, sexual dysfunction, and the socio-emotional side effects of anal cancer. Each of the following experts will address one component of reset. And then we'll hear stories from 2 thrivers. At the end, we're going to come back together for a live Q&A. So thank you so much for joining us this afternoon. Let's get started with Dr. Scheich.